Good morning, everyone. It's a pleasure to be here, and thank you for the time. My name is Dr. Hari Hendarto. Allow me to share a few words about my presentation with title The Prevalences of COVID-19 Vaccine Side Effect Among Lecturers and Teaching Staff at Islamic State University, UIN Syarif Hidayatullah, Jakarta. To begin with, currently vaccine coverage in Indonesia are still low. As of July 29, 2021, as many as 22.36% Indonesian people have received their first vaccination. Meanwhile, around 9.54% people have received their second vaccination. Indonesian government states that to fulfill the requirement for the formation of herd immunity, it will require the minimal of national vaccination coverage target approximately around 181.5 million people, or 70% of the total of Indonesian population. Survey study on COVID-19 vaccine acceptance rate showed that the low rates of COVID-19 vaccine acceptance were reported in several countries, including Indonesia. So this condition could represent a major problem in the global efforts to control the current COVID-19 pandemic. So what is causing vaccine delay? We know that the incidence of adverse effect following the immunization, COVID-19 vaccination has an important impact on the level of public confidence in the benefit and participation. Reduced confidence in immunization due to public concern, especially when it's strengthened by the mass media reporting cases of adverse effects that have occurred. Lecturers and teaching staff are in the best position to understand their hesitance, to respond to their worries and concerns, and to find ways of explaining to them the benefit of COVID vaccination. A lot of inaccurate and unclear info, basically saying that the vaccine is not halal. Halal means fit for eating or using it under Islamic law. So people's doubt about whether the vaccine is halal or not may have a negative impact on their perception of vaccine safety and affect their desire to be vaccinated. So it will impact the vaccine coverage. With the mass vaccination had been done in Islamic State University, UIN Syarif Hidayatullah Jakarta, which is the largest Islamic university in Indonesia, we hope that directly it showed that the vaccination can be interpreted as halal. The aim of this study is to investigate the adverse event following immunization for COVID-19 among lecturers and teaching staff at Islamic State University, UIN Syarif Hidayatullah, Jakarta. The Indonesian Food and Drug Supervisor Agency in January 2021 also issued an emergency use permit for the Sinovac vaccine after showing the effectiveness of 65.3% in the phase 3 of clinical trial, which is the final stage before the vaccine can be distributed and released to the wider community. The study was held on March and April 2021. We investigate the adverse effect following immunization of the Sinovac vaccine for COVID-19 during the 30 minutes, 24 hours, and 3 days after the vaccination among lecturer and teaching staff. And all the participants must above 18 years old and had received the complete doses of the Sinovac vaccine. We use Google Web Form, self-administered by the candidate, contain validated questionnaire with a multiple choice model. In our study, during the vaccination period, in March and April 2021, A total of 518 participants complete the questionnaire and have received the 2 doses of the vaccine. The response rate was 32% and consists of 43% women and 57% men. There was no specific difference number case of the side effect by Sinovac vaccine between male and female. Number of participant classification by age. It ranged between 20 to 76 years old with a median of 43 years old, given the fact that the mean age of the study's participants is between 36 to 45 years old. The adverse event following the first dose immunization with Sinovac vaccine was lower number case in the elderly population. In the second dose vaccination, that the elderly population show lower number case of side effect. Older adults are at the highest risk of getting infected with COVID-19 and experiencing severe illness increasing with age. This is why it is important for older adults to get the vaccine as soon as possible. We can see in the study the elderly population show lower number case of side effect because the number of elderly participants was also low. One explanation is because the number of active elderly lecturers and teaching staff was relatively small. Another explanation, most of the retired population in Indonesia have low mobility and spend more time at home with less traveling. These behaviors may lead them to having a lower perceived risk of being infected with SARS-CoV-2 and may lead to the lower acceptance of a vaccination program. Furthermore, the study limitation, we use Google platform, which is also not frequently accessed by older adults, so maybe this can explain why the number of participants in the elderly population was small. The most common side effect of the first dose Sinovac vaccine, including injection site pain, drowsiness, fatigue, headache, chill, and feeling hungry. This graphic too shows the same most common side effect of the second dose Sinovac vaccine. But the important thing is all the adverse event reactions were generally categorized mild, which is no one need to go to the hospital or even dead. Furthermore, all the reaction was totally resolved within a week without additional problems. These results are expected to increase confidence in safety of COVID-19 vaccination without significant side effects. All results are similar to other studies. First, the most side effects were mild. Second, injection site pain was the most frequent local adverse event of the Sinovac vaccine. Third, other main side effects, including drowsiness, fatigue, headache, chills, and hungry. All the reactions were resolved within a week without additional problem. The summary of the main point. First, our study showed that the most common effect of the Sinovac vaccine, including injection site pain, drowsiness, fatigue, headache, chills, and feeling hungry. Second, all the reactions were generally mild and resolved within a week without additional problem. So, these results are expected to increase public confidence in the halal and safety of COVID-19 vaccination program without significant side effects. Thank you for your time for listening to my presentation.